So Mita, in layman's terms, what is sedation?
Sedation is a technique used to allow people with dental anxieties or going through a complex procedure to be able to be comfortable and relaxed during the procedure.
And who do you find are the typical patients that will benefit from the sedation?
Sedation is particularly beneficial for anyone who has dental anxieties, dental phobias, who doesn't want to be aware of what's happening during their treatment. And it's also beneficial for the patient who can sometimes comfortably cope with routine dental care, but find certain things like extractions or implant surgery a little bit overwhelming.
Right. So what is the experience of the patient during and after the treatment under sedation?
Well, during sedation, the patient is monitored by a highly qualified dental team who will look after the patient. We will ensure that they're comfortable, that they're unaware of what's going on. They are able to talk, but they do feel quite oblivious of time, how long they've been here, and what's been carried out.
So have you found that anxious patients who have had sedation will continually need it for future treatments?
That all depends on what the sedation was given for in the first place. If it's for someone who is extremely anxious and they can't cope with having their dental treatment any other way, then at least we have found a way where they can comfortably accept their care. But for some people, because they feel that they've met a team that are alert to their anxieties, they find they can cope with some simple treatments without the sedation.
So in your career to date, how many sedation cases have you carried out?
I've carried out over 3,000 dental sedation cases. I've been qualified for 21 years and I've always done sedation throughout my career. In the past 13 years, this is where most of the 3,000 cases have been carried out. And I hold a diploma in dental sedation, which was acquired at the Centre of Excellence at Guy's, King's and St Thomas in London.
So tell me about how patients are taken care of at Cliftonville Dental.
Patients are invited initially for an assessment appointment to discuss their needs, whether it be their dental needs or whether it be their anxiety or sedation needs. At that appointment, it's a little bit like having an MOT, and the patient will have their blood pressure, their medical history checked, and we will go through all the basic medical details to ensure that the techniques used are appropriate for that person.
So Amita, how can an anxious patient begin their journey with you then?
So as I mentioned earlier, we will first of all start with an assessment appointment so that you can meet the dental team and obviously be comfortable with your environment here. We will at that appointment go through what needs to be done, what is the procedure, what you will feel like and how you will feel like after the appointment, and hopefully cover all your questions and answer them thoroughly.